Hi, my name is Eleanor Tatum, and I'm the publisher and editor-in-chief of the New York Amsterdam News. The coronavirus crisis has brought serious distress to local economies and advertising along with them. The New York Amsterdam News has partnered with the Local Media Association during this unprecedented crisis. Help us continue our important work in chronicling the life of Black New Yorkers, and consider making a donation to the COVID-19 Local News Fund today. Go to givebutter.com/Amsterdam News. Again, that is givebutter.com/Amsterdam News. Thank you and stay safe.
It's Thursday, April 30th, and welcome to the New York Amsterdam News Podcast. I'm Cyril Josh Barker. We continue our coverage of the COVID-19 outbreak with my guest, Newark, New Jersey Mayor Baraka. He's going to be speaking with me about how COVID-19 is impacting his city. The state of New Jersey has the second highest number of COVID-19 cases in America. As of April 30th, the Garden State has over 116,000 confirmed cases and over 6,700 people have died. In Essex County, where Newark is located, there are over 13,000 coronavirus cases and over 1,100 deaths. A large number of those who have died are Black. Newark Mayor Baraka has taken several measures to slow down the spread of the virus, including implementing Be Still Mondays earlier this month, requesting that all businesses except for health, safety, and welfare emergency services close. And we welcome you to this episode of our podcast. We're going to speak with Mayor Baraka here in a moment. He certainly has a lot to say, especially what's been going on right now with New Jersey Governor Phil Murphy announcing that he and President Donald Trump are going to be meeting at the White House to discuss how they can open up New Jersey and think of ways they can slow down the spread in the Garden State. Well, it is Thursday, and today the paper did come out, so we have some great stories in the paper and online. The first is our front page story called Essential Elements, and it deals with the essential workers here in New York City, the majority of which who are Black. Myself and Nayaba Arinde worked on this story, and we spoke to several essential workers, including nurses. I spoke to an EMT and also a MTA subway driver to talk about what they're facing right now as essential workers. Very eye-opening piece. Another story that we have is based on our podcast that we did a couple weeks ago with Mayor Bill de Blasio about his blueprint to open the city, as well as the fact that his wife is actually now the head of the COVID-19 Racial Disparity Task Force. So we get into that a little deeper than we did for the podcast. And then our final story in arts and entertainment, we have several, but this is just one of them that we want you to check out that we're going to talk about here. It's our art and entertainment piece about 5 Black must-watch documentaries that are available on streaming platforms. It's a phenomenal story. There are 5 documentaries that we think you would like. You can see them on Hulu, Netflix, and a whole bunch of other streaming platforms, and we certainly hope that you check that out. You can check out all these stories and more. Of course, you can go to newsstands, but be sure to do it safely and wear a mask, or you can go online to our website, amsterdamnews.com, and check out all of these stories. Well, my guest today is Newark Mayor Baraka, and he's on the phone with me to discuss how his city is combating coronavirus. Welcome to the podcast, Mayor Baraka. How are you?
I'm great. How are you?
I'm doing fine, thank you.
Thank you.
Yeah. Well, thank you so much for being on the podcast. So much going on. I'm so glad that we have the opportunity to speak to you to get an idea of what's going on in New Jersey, especially in Newark, when it comes to COVID-19. First, give us an update of what is going on right now with COVID-19 in Newark.
Well, we have over 5,000 confirmed cases in the city now. Almost 400 deaths in the city as well. So we probably have more deaths in Newark than almost any city in the state now. Essex County, where Newark is one of the counties that, besides Hudson County and Bergen County, has one of the largest amounts of cases. The northern part of New Jersey has been hit the hardest by COVID.
Okay.
Yep.
Go ahead. Go ahead.
Yeah. And I'm just to kind of our response. We have besides the try to take care of the small businesses, because we've shut everything down. We've been shut down probably since the the 13th or the 14th of March, we have had a stay-at-home order. We shut mostly all of the businesses down except supermarkets and pharmacies, maybe gas stations. We, we have something called Be Still Mondays, where we try to give a break even to the essential workers. We try to give them an opportunity to stay home, so we try to shut everything down on Mondays. That is not mandatory. We try to, urge people to do it the most. A lot of people are listening. Many people aren't, but, we are still asserting it throughout the city. We've been given, like I said, we've given grants to businesses up to $10,000, small businesses, nonprofits, arts organizations as well. We had to stand up two kind of buildings, one for homeless folks in the city so we could get them off the street. The second for folks that are positive that we have to quarantine, that have nowhere to quarantine, or they live in a place where they can't quarantine, or they don't have a place to live at all. So,
all right.
Some of the things, yeah.
Yeah. One of the things I wanted to ask you about, which is something I'm asking several of the mayors that I speak to, or any person in leadership that I ask, is what are your thoughts on how this pandemic is impacting the Black community? We're seeing the news reports, we're seeing the numbers. Even in New Jersey, there's a disproportionate number of African Americans that are being impacted by this pandemic. What are your thoughts on that?
Well, it's not surprising to me. I think that the pandemic is really just taking advantage of the weaknesses that exist in the system, the inequality that's here. Our community has lack of access to health care the way we should. We have lack of access to healthy foods. We disproportionately have these kind of pre-existing illnesses that make it easier for us to succumb to COVID, like heart disease, high blood pressure, diabetes, those kind of things. I mean, the poverty that exists in our community, as I said earlier, make it difficult for people to even social distance. They live on top of each other in close quarters.
Right.
If somebody gets sick, they usually get everybody sick, so there's nowhere for them to social distance, right? They can't go to the third floor, the fourth floor, the den, the guest room. If you're sick, you have to go home, and you basically live in a one-bedroom, two-bedroom apartment, and 75% of the city is renters. So, I mean, it uses this as an opportunity to infect everyone. Plus, we're disproportionately more than anybody the essential workers, right? So we out here working, we driving the buses, waiting the tables, cleaning the buildings, working in the supermarkets, all of those things are the reason why we are hit harder than anybody else.
And it's interesting you say that. Our front page story this week was about the fact that the majority of essential workers, not just here in New York City, but in other places, are Black people. They're the ones who are driving the buses, like you said, running the subway, running our trains, working in our hospitals.
Right.
And so that's so interesting that you say that. Governor Murphy today, this is Thursday, April 30th, he went to the White House today. I don't know if you've seen it yet. What are your thoughts on their meeting? What do you think? What do you think about that situation? What are your thoughts with that?
Can you repeat that? I'm sorry.
I'm sorry.
Exactly what you said.
The question was about Governor Murphy is at the White House today, April 30th, with President Trump, and I wanted to know your thoughts on their meeting.
Well, I hope that he's gonna be able to convince him to do a few things. One, to push the Defense Production Act. I mean, whether we like it or not, the guy's the president, and he has not done the things that we need, and hopefully he can convince him to do those things. We should not be competing on an open market for PPE, for tests, for all the ventilators, everything that we need. We're competing with other states, cities, and townships for this stuff. This stuff should be being produced. There are countries that has less the infrastructure, industrial infrastructure, the scientists, the engineers, the resources to put this stuff together, and have already moved faster than us on many of these things. So hopefully he can get him to do that, right? We need testing. We need all of the things that are necessary to make this thing happen. We also, hopefully he can convince him to bring money to these cities that are going to be in serious distress, and states after this is over, right? They're going to be in serious distress, which is going to add more on top of what we're already dealing with. We're going to have to lay off workers, and most of those workers that are going to be laid off are probably going to look like, black and brown folks, look like me. So
absolutely.
it's important for him to convince him he needs to bring money to these cities and to these states. And any small businesses in these communities that did not get anything from the first round, or second or third round of money that went out. So I hope it's a productive meeting. I hope that he can come back home with some good news for us all, because it's incredibly important for that to happen now.
Yeah. Absolutely. I want to shift the conversation now to education. You actually closed Newark Public Schools before New York City did. Tell me about that decision. How are things going with education? I know that students are remote learning. Yesterday here in New York, they changed the grading policy for public school students. Tell us about Newark Public Schools and how that's going.
Well, the state actually closed all of the schools. I don't have any control over the public school system, but they closed them. But the superintendent was in a process of closing our schools before the state mandate. But at the end of the day, we have about 40,000 kids. About 7,000 of them didn't have access to internet or a computer in their home. The school system was able to get 7,000 Chromebooks, and we began sending them, dropping them off, or having them picked up by students and their families so they could be able to do this. And the local cable company, extended free Wi-Fi to these families. Many of the schools are doing well, so, in terms of attendance and all that, but some of them, of course, are not. Mm-hmm. So, obviously there's going to be a gap between then and what's happening now in terms of the educational trajectory of where students were. Mm-hmm. The state has suspended the testing requirements for this year. So, they have to. Teachers still are required to grade. They're still required to give assignments. Kids are still doing assignments. They're doing like whole school almost online, from opening exercises all the way to lunch to the closing of the day. That's what's actually happening. So they're running school remotely. So they didn't just walk away. So they're still running the school remotely, and they're still grading kids. They're still contacting parents, doing all the things they're supposed to do. But it's 100 times more difficult for them to do this under these conditions. Particularly since no one has ever been used to or been prepared for running school this way.
One of the things that you discussed earlier before we got into at the head of the podcast was about the fact that you implemented Be Still Mondays, which is something that I think a lot of cities should be doing. You basically are closing down, asking people to shut down and close businesses that are non-essential. For 1 day a week. Tell me about the thought process of making that decision to have that, and is it working? Are the numbers down? What's the result of that?
Well, yeah, for Mondays for the essential workers, we made a decision to do that because there's many workers. Folks have been contacting me, contacting the office. That work at these places, work at these warehouses that produce the things that you folks need. That work at the pharmacy, that work at the supermarket. First of all, in the beginning, nobody even thought about them in terms of their safety. And since then, now people are required to wear masks and gloves. These stores are putting up barriers between the cashiers and folks that have to go shopping. They're doing all these things at warehouses. They're taking temperatures. They're doing all this. Before, they was doing none of it. And they're requiring these people, they have to come to work, and they are getting sick, and people are, infecting their families. So, as I said, because we live in the city the way we live, if somebody gets infected, they're liable to infect at least 5 or 6 other people immediately because they live with them. So we created a day where those essential workers could stay home. Everybody, the people who clean the building, the people who, even our folks, the people who picking up our sanitation workers, the folks that clean our buildings, the people that have to collect taxes, have to do all this stuff, but they have to stay home. We make everybody stay home that day. We want everybody in the city to just be still and do nothing. And we want the entire city to shut completely down. We are not exactly where we want to be in terms of, obviously because it is not a state order. And us doing that goes against, the state's executive order. But we have been getting a lot of folks who are saying, okay, I'm going to listen to the mayor, we're going to do this. So a lot of businesses have been doing it. And each Monday, more and more businesses, in fact, close down. We want to continue that and continue to urge them to do that so we could get less people that are infected or is in contact with this disease than anybody else. And that's what the idea is. And to build solidarity, between us and then everybody else in the city. Give us something to look forward to in this pandemic that we do collectively with each other. It's like a opportunity for us to fight back.
Absolutely. And something that you did that a lot of cities are doing, small businesses are, of course, hurting during this time of COVID-19 because of the shutdowns. You recently awarded some grants through the Small Business Emergency Fund, and I want you to talk about that. Where did the idea come from? If you know anything about who got the grants, how they were doled out, and I know that you're going to do some more, please tell us about that.
Yeah, well, we talked about that here locally. It came from our office, and myself, the deputy mayor here, economic development, we found some dollars that we had in the city that are entitlement funds that we get from the federal government, and we just repurposed those entitlement funds, about $6 million, and began to give them out to the businesses and nonprofits and arts organizations, stuff like that in the city. We so far have given out about 21 of these grants. We've also gotten help from some of the local corporations who thought it was a good idea and threw some money into it as well. So we gave out 21 grants. We're in the process of giving out more. So folks are filling out applications. We take them through a process. We have like maybe 9,000 local businesses here who are eligible for it. 21, giving out 21 is certainly nowhere near what we need to give out. And, we want to give out more. We obviously don't have all of the money that we need to do that. So we've been asking for help. So it'd be great if we could do all of these businesses if it was possible. It's important for us to do something because, a lot of folks are not going to get the money from the stimulus or get PPP. There are a lot more work that's going out. Yeah. A lot more opportunity and folks that are trying to navigate that. You even got Sean Combs trying to put some stuff together.
I saw that.
Yeah. So all of these people can be in touch with trying to get this money. Because we're not getting the money, but it goes to Los Angeles Lakers, right? They get $4 million.
Right.
It's ridiculous, right? So I don't understand if they even know what a small business is,
right?
But we are trying to make sure that more businesses are getting as much money as we can, either through us giving them the money, or through us helping them get money from the federal government or even the state government. The state government has a few. Those are loans, but they still have some money that they can give them.
Okay. I know that you do something that I watch on a regular basis is that you are actually connecting with your constituents, with the citizens of Newark every day on Facebook Live. Tell us how that's going. I know I'm a regular watcher because I like to see what's going on because, the networks, they put on Mayor de Blasio and the president and then Governor Cuomo every day. Yeah. But you've elected to do this yourself and do Facebook Live. How's that going? Has it been working? How effective has it been? How's that going?
Sure. I think, we get a lot of initial views like on live, then we leave it up, and then we get thousands and thousands of people who actually watch that.
Okay.
People watch it religiously, and a lot of these folks are connected to that. Then we put it on, like we leave it on that, and then we put it on our local cable.
Oh,
here
okay, all right,
as well. Yeah, so we shoot it on local cable and they put it up every day so people could go home and watch it on cable TV,
right,
on the local Cablevision station. So a lot of people get a chance to look at that.
Yeah.
Once it's done. So and you can tell as people talk about it often.
Yeah.
And we continue to push it that way, and we run it, as long as we can, and then we put the next one up the next day, and we run it all day like that. So people, there are a lot of seniors who watch the local cable, and we try to urge a lot of other folks who don't normally watch local cable, who are into, like the millennials, who are into the computer. They watch it on a computer, but we think everybody else can get a hold of it once if they're essential workers, if they do other things, they can come and watch it on the Cablevision.
Okay, I didn't know it was on Cablevision. That's pretty cool. All right.
Yeah.
There's a lot of talk right now in the nation about opening things back up. Some states have decided to open up. New Jersey is not one of them. New York is not one of them. But what is the plan to open Newark back up? Because that's the number one question that I know that we get at the Amsterdam News. People are constantly asking us to ask our electeds, when are things going to be back to normal, and what does the plan look like to open Newark back up?
Well, actually, the state is contemplating, doing gradual opening up. They just allowed parks to be opened up for Saturday, and they're going to do all this other stuff gradually. But I think, the most important thing is for us to begin to see the numbers go in the other direction. So we want to see a smaller number of new contracts a day. We want folks who are getting the illness. We want that number to get smaller and smaller each day, and be sustained that way. What's also important for us in Newark, to be able to have our hospitals be able to be cleared. Like if somebody gets sick, they should be able to go to the hospital, right? Mm-hmm. So right now, because everything is so backed up and it's so much activity in these hospitals, there are folks who actually get turned away from the hospital and go home. But some of them actually died in their house.
Yeah. We've heard of that. Yeah.
It's important for people to, like, if you get sick normally, you could go to the hospital and get a bed, Mm-hmm. Even if you have to wait an hour or two. Now, I mean, they're turning people away. So that's important. We have to, because people are going to continue to get sick unless there's some kind of cure or vaccine. Then even if it's small numbers, we need to make sure that those people have some way to get into the hospital and it's okay. I mean, that's important for us, and that people have a place to actually quarantine safely.
Right.
That there's places that people can go to be quarantined if they are in fact sick without getting other people sick. We have a couple of spaces. Obviously, we need more, and we need support to help stand up a few places, not just in Newark, and places that are like Newark throughout the state of New Jersey, throughout this county even. We need that, and we need a significant amount of testing, more testing to be done, and contact tracing. Like in Newark, we're in the process of training about 200 contact tracers now.
Okay.
Prayerfully, they'll be ready to go like Monday or Tuesday and begin to start contact tracing all of these positive tests that we have. We had about maybe 8 folks doing it. This is not nearly enough, moving as fast as they can. And so we had to find additional volunteers and folks from schools, from inside city government, from different places, mm-hmm. And train them to contact trace and begin to connect ourselves with these kind of commercial testing vendors to bring tests into the city of Newark to start testing our residents. We just started testing senior citizens. We're going to go to the long-term healthcare facilities and test those folks, mm-hmm. and then folks in our housing projects. We're going to do that group of people obviously first. We think they are the most vulnerable, and we've already started testing our first responders, like police officers, fire. Next is our water and sanitation folks. But we want to test as many people as possible and begin to isolate folks and quarantine them. And, that will help us have a better idea, a better picture of when we can, in fact, open up safely. And when we do, I think we should open up in 2-week intervals and not like, these people are doing. They just like eeny, meeny, miny, mo. Let's open up the museum. Let's open up the movie theater.
Right.
So we start opening up. We open up one industry at a time. We say all of the warehouses can open. Then we give them a 2-week interval, and then we open other things because we want to make sure that there's no spike, right?
Right.
So, and it gives us the opportunity to follow the disease and see if it's affecting people more because we opened up these industries. It'd be easier for us to scale it back than for us to say, everybody can open up now, and then we get in such a crazy situation. All of the social distancing work that we did is destroyed.
Wow. The last thing I want to ask you about is the U.S. Census. I know that you, even with everything that's going on, you are pushing your citizens and everybody to do the census. I know that you recently had an event, and I do want to talk to you about your efforts, that even during everything that's going on with COVID-19, you're still pushing people to fill out their census.
Right. Because it's necessary. I mean, the world is going to continue, and at the end of the day, the census, you're talking about hundreds of billions of dollars that's being disseminated throughout the country. We already are undercounted historically, and we want to, and if we got more money through the census the way we should in terms of being counted the property the first time, maybe we would be able to handle more of this stuff. For example, we'd have more entitlement dollars. We could be able to give out more money to small businesses in situations like this. This money is used for homeless folks, it's used for shelters, it's used, for after-school programming, for school lunch. All this stuff is so incredibly important, and people don't see the importance of. They don't see the relationship between the money and their lives, and we have to make sure that there's some clarity around that and make it easier for people to do that. And plus, they just don't trust government, period. So it's difficult for them to fill out stuff and turn it in.
Right.
And we are trying our best to make people understand that is crucial for you to fill the census out. We need this at this time. And so hopefully people are doing it,
All right. Well, listen, Mayor Baraka, I really appreciate you being on the podcast, and the best of luck. And we're definitely going to follow up with you later on to see how things are going in Newark. Thank you.
You got it. Thank you, man.
That concludes this week's podcast. You can pick up the latest edition of the New York Amsterdam News on newsstands and get updates online at amsterdamnews.com. You can also keep up with us on Facebook at NY Amsterdam News and follow us on Twitter at NYAmNews. I'm Cyril Josh Barker. Thanks for listening.
Hi, my name is Eleanor Tatum, and I'm the publisher and editor-in-chief of the New York Amsterdam News. The coronavirus crisis has brought serious distress to local economies and advertising along with them. The New York Amsterdam News has partnered with the Local Media Association during this unprecedented crisis. Help us continue our important work in chronicling the life of Black New Yorkers, and consider making a donation to the COVID-19 Local News Fund today. Go to givebutter.com/Amsterdam News. Again, that is givebutter.com/Amsterdam News. Thank you and stay safe.